A significant shift in the leadership of a critical U.S. health agency has sparked controversy and concern. President Donald Trump has appointed Jim O'Neill, a former investor and critic of health regulations, to take over as the acting director of the Centers for Disease Control and Prevention, CDC, replacing Susan Monarez, a seasoned government scientist. O'Neill, who previously served as the deputy at the Department of Health and Human Services, HHS, under Health Secretary Robert F. Kennedy, Jr., will assume control of the CDC following a turbulent period marked by the abrupt departure of Monarez, who had been in the role for less than a month. Monarez's lawyers stated that she was removed because she refused to endorse unscientific directives and dismiss dedicated health experts. This appointment comes at a time when the CDC is facing significant upheaval, with recent firings, resignations, and ongoing efforts by Kennedy to reshape national vaccine policies to align with his personal beliefs about their safety and effectiveness. An HHS spokesperson confirmed O'Neill's new role, but provided limited details on how it will be structured alongside his existing responsibilities. But here's where it gets controversial. O'Neill has no formal training in medicine or healthcare. Instead, he holds degrees in humanities and has a background in finance and technology, having worked closely with billionaire tech entrepreneur Peter Thiel. One of his notable projects involved developing man-made islands outside U.S. territory to experiment with alternative forms of governance. Despite his lack of medical expertise, O'Neill is seen as a Washington insider on a team of outsiders. Unlike other top health officials in the Trump administration, O'Neill has a history with HHS, having served under President George W. Bush. Those familiar with him suggest he may be tasked with stabilizing the CDC, though his independence from Kennedy remains uncertain. Jim O'Neill is a healthcare policy professional, and I don't think anyone can accuse him of being an RFK Jr. sock puppet, commented Peter Pitts, a former FDA official. However, the real question is whether the CDC director's role will become a mere figurehead, following orders from the secretary. O'Neill is not closely aligned with Kennedy's Make America Healthy Again movement, which has been critical of food dyes, fluoride, and ultra-processed foods. Additionally, unlike some other Trump officials, O'Neill did not heavily criticize public health measures during the pandemic, though he did express skepticism about FDA regulations, particularly regarding unproven treatments for COVID-19. O'Neill's ties to the libertarian wing of the Republican Party, including his association with Peter Thiel, suggest a strong belief in reducing government regulation. During Trump's first term, O'Neill was considered for the FDA leadership role, but his views on loosening drug approval standards raised concerns among industry leaders. In his confirmation hearing, O'Neill voiced support for the CDC's traditional vaccine oversight system while declining to criticize Kennedy's stance on vaccines. This balance may be tested soon, as O'Neill could be asked to approve new vaccine recommendations from a CDC panel that Kennedy has reshaped with vaccine skeptics. Former CDC acting director Dr. Richard Besser noted that Monarez was removed, in part, for refusing to automatically sign off on the committee's recommendations. As an acting director, O'Neill has a limited tenure of 210 days before he must either step down or be formally nominated. And this is the part most people miss. The dual roles O'Neill will juggle at HHS and the CDC are highly demanding and typically require full-time attention. Dr. Ann Schuchat, a former acting CDC director, warns that the simultaneous responsibilities could be challenging, especially given the recent exodus of experienced CDC leaders. The appointment of O'Neill to this crucial position highlights the ongoing tension between scientific expertise and political influence in the realm of public health. What do you think about this move? Is O'Neill the right person for the job? Or does his lack of medical background pose a risk to the CDC's mission? Share your thoughts in the comments.